and welcome to
Live, Laugh, Lol.
We've Got Cancer.
Oh, we're getting worse at that. Never mind.
Never mind. Don't know what episode we're on now either, but thanks again for tuning in.
I think we might be on episode 14.
Excited.
That's crazy.
Yeah, and we're gonna talk about menopause.
The menopause, yeah, and womanly things.
Womanly things.
It's like Woman's Hour, except interesting to all genders.
Yeah.
That Woman's Hour is also interesting to all genders, though. So, yeah. I mean, don't be put off. It's so interesting.
I've never listened to it, but
I listen to it sometimes, but only because when Mark and I do long drives, we put Radio 4 on for the chat, and sometimes it's Woman's Hour and sometimes it's not.
Oh, okay.
But we would not turn it off just because it was Woman's Hour.
Great, but before we do that, we are going to chat about our weeks.
Yeah.
Yeah.
What have you been up to?
Well, I haven't...
Did you talk about Spain on the last one?
No.
Right, let's talk about Spain.
Yeah, so I did a sneaky holiday. I say sneaky because it was very last minute. But...
Jess was like, let's all go to Filey and celebrate my 1 year anniversary of diagnosis. Yeah. And then 3 days before Filey, cancelled it.
I'm going on holiday instead because I really wanted to go to Granada in Spain. It'd been on the bucket list for a little while. There's a really beautiful palace there called the Alhambra, which is on a mountain in the middle of the city. Really beautiful architecture. And I'm a bit of a history geek, so I was like, if I can I didn't have anything apart from the 1 year anniversary. I was like, I can cancel on all my friends.
Yeah.
And then just go there. So I went with my friend Laura, who is the perfect travel companion because neither of us plan anything, and yet somehow it always works out for us. So despite not having really booked anything until a couple of days before, it was a great trip.
Yeah.
Woo-hoo.
I think that was the absolute best decision. I think sometimes the last minute trips when you can see a window of not being in hospital and having the free access to go, it's just so great. You got to jump on it.
Yeah, because I didn't know, I'm obviously in between trials and treatment and stuff, so I don't know what when I get on whatever form of treatment I'm on next, don't know what it's going to look like. So I was like, I might as well take this window of opportunity.
Yeah, and you did the right thing.
Yeah, but it did mean that I then have knackered myself out and I did have to do quite a lot of recovery. So actually this week has been very boring of me just lying around, and I didn't really see anyone, but somehow I have picked up a chest infection.
I know, I'm fuming for you. This is... Okay, I'm going to swoop in because I am ready to rant about this.
Well, do your week first, and then we will go to the...
Okay, because I've got a lot of energy inside me that needs to come out on that topic. Okay, I went to Glastonbury.
Woohoo! That's such exciting news.
It was such a good time, honestly. Can't even tell you all. I've been to Glastonbury once before, but it was 10 years ago. I don't remember it that well. And when the headline, whatever, the music lineup came out, I was like, I really don't know anyone that's playing, so maybe this isn't going to be as good as all that. So a bit like thinking, oh, it might be dare I say it, it might be a bit shit. Anywho, we got there and it wasn't shit at all. In fact, not knowing anyone in the lineup took all the stress away of, I need to be here, there and everywhere. So instead of being stressed, it was just yeah, I'll go with you, or I'll go with you. I'll just go to whoever. And I think this is a mark of how good Glastonbury was. The people, so my top 3 of the people I saw are different to the people that saw different people. They might have seen, you see some of the same people and some different people, and their top 3 people are people I didn't even see. My top 3 people are people they didn't see. You know, that kind of environment of you couldn't lose.
Yeah.
Everyone was
Everything
so
was good. Whatever you choose to see.
Exactly.
So your top 3 were?
My top 3, I'm so glad you asked. For emotion, it was Lewis Capaldi. I shed a tear. Mark had a lump in his throat, and that's unusual for Mark, so I feel like it really was emotional. Number 2 for entertainment factor was Busta Rhymes. He was there to put on a show, which I respect, and they were just having loads of fun, and it was all dramatic faces, they really were there to entertain. And then number 3 for crowd energy was Prodigy, because the energy in the crowd was incredible. So you got that real buzz of like, ah! So that was really good. But everyone I saw was good. And I applied for an access pass for some shortcuts.
Yeah, this is really handy.
Really handy. So I applied for it based on the cancer being in my bones. And although I'm pretty much asymptomatic, my pelvis, which is one of the parts where the cancer is, it really starts to ache after like a lot of walking, or just like a lot of standing still upright. Like standing in a queue is almost worse than doing lots of walking. It just really aches. And so I applied for the access pass, which let me do a few shortcuts, which really, really helped. And on one of the days, I did Glastonbury sober. I did have 1 glass of champagne when I was feeling really resentful for being sober. But apart from that, I was sober. And on one of the days, I was walking back really late. It's like 3 o'clock in the morning. I tried to keep up with everyone. And I was laying on the floor. My back was so done. My pelvis was like, you can't move me anymore. And this really nice woman, Mark, was looking over me like, come on. And this woman came over like, oh my God, are you okay? And I was so embarrassed. I had to be like, I'm fully sober. and this is my husband. Achy. Like, I'm absolutely fine. I just have an achy back. Yeah, I'm just in my 30s now. and I ache and have ailments. But it was really nice. That's like the vibe of Glastonbury. Everyone's kind of looking out for people. Obviously,
yeah, that's so cute.
That's what I've seen of Glastonbury, so it was nice.
Yeah.
And the access pass got you onto the accessible stands, which just basically give you a bit more space. The BSL stuff happens there, but it also means like if you need to sit down, you can be in the crowd but sat down and like rest your back.
That's so good.
Yeah, it was really good. The shortcuts for me with my back were the most important, but it was nice to be able to get out of the crowd and sit down as well.
Yeah.
Yeah, so thank you, Glastonbury. Oh my God, but I do have a complaint. Even though Glastonbury doing so well, blah, 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 I love you. There was like hardly any 0 alcohol beer.
Oh, really?
I was expecting there to be loads of like dash cans, which are the fruity drinks with no sugar and no crap. Kombucha, like all the stuff I could have. Not at all. There were 2 0 alcohol beers that I could see in the whole festival. One was by Brothers, which was like 1.8 grams of sugar per 100ml, which is more than I'd normally allow. And one was an Erdinger, which was like 3 grams of sugar per 100ml, which again is like you can get non-alcohol beer for like 0.01 grams, so I'd normally go for that. So I was fuming, really. Luckily, I'd packed my own non-alcohol beer in my tent, and I just decanted it and took it in with me, but I was surprised.
Yeah, that is surprising. Especially because, it's a big thing nowadays, isn't it? Alcohol-free stuff.
So I will write in. I'll make this go viral. I'll do a video and it'll go viral, and we'll be like, bring alcohol-free beer into Glastonbury in a better way.
That'll be your legacy.
That'll be my legacy.
Part of it.
Yeah. Well, I mean, do you need more than that? Anyway, I've just rambled for ages about Glastonbury, but that was that.
That sounds like a great week.
It was a great week.
So we then can move on to
my rant.
I feel like you've got more of a rant in you than I do.
But it was about Jess.
But it is about me. And as you can hear probably, I am still a bit breathless. So chest infection. Last week I was resting after holiday, was feeling fine, on the whole just sleeping a lot. And then over like 2 or 3 days I started to feel really breathless. And I've started to do an art class.
Yes.
I should have said that in my week, actually.
Yeah, you should have. And she's really good at art. It's drawing and really good sketches.
Life drawing.
Really good.
So I kind of noticed when I was there, the last pose was like 45 minutes. And so we were all standing up and I was like, oh, I couldn't even stand up. I had to sit down a couple of times during that process. And then I drove home, and then walking from the car to my flat, when I got to my front door, I was like breathing like I just tried to do a 10k. So I was like, okay, this is not good. So I'll go into hospital, get checked out, see what it is. The worry is obviously because I'm not on treatment at the moment. I was like, maybe it's the cancer progression in my lungs, and then that would be shit because it's like less curable. Like they can't just give me an easy fix. and the breathlessness will go away. I'll have to wait a bit of time to kind of get on chemo or get on some kind of treatment to sort it out. So I was hoping it wasn't that, but you got to go in and get checked.
Yeah, so she always does the right thing, and she always goes in to get checked. So we're all very happy about that. And that was the right thing. Well done to you. Big tick to Jess. Did the NHS thank her for it? No. So what was it? So I'd been in... Okay, it's coming. Bear in mind, I'd been in at 8:15 to get my bloods done before my appointment.
Yeah.
That all was late anyway, so never mind. Got my bloods done, had my appointment, and she said, by the way, in the appointment, I was asking about going on bigger trips later on in the year, and she said, we want to support you with the time you have left.
Oh.
Well, I think they've been on a course about what phrases to use, quality of life and the time you have left, and I think whoever's teaching that course is doing it wrong. So that's just my opinion on that. Just wanted to add that in.
That's terrible, especially because you were just inquiring about future holidays. You're
I want to go
dive this into a discussion about prognosis, and
I wonder if I could go to Australia in December. Well, we just want to support you for what time you got left. Okay.
Thank you for that reminder.
Mine felt quite cheery, and you've somehow managed to make it sound really shit.
Classic.
Anyway, so then Jess was like, "Oh, I'm coming in." So I was like, "Well, I've just had my appointment, so I'll come and grab you because she lives really close to the hospital anyway." So I grabbed her. We come in. We're in for say 10 a.m, 10:30. Okay?
Yeah.
And then, Jess, to be fair, we go in and straight away they're like, have an x-ray. We're not waiting that long.
Yeah, the usual process, because there's like a part of the hospital, it's like A&E, but specifically for oncology, which is great. So you don't have to go and sit in A&E for ages, but sometimes the wait time can be
long,
similar to an A&E wait. So you kind of go in, they'll take your observation, they'll take a blood sample, and then they might, like because I was breathless, they'll send me for an x-ray, but then you have to wait ages for the bloods to come back. That usually takes 2 or 3 hours.
Usually, but not on that day.
Not this time. And then you have to wait for once you've had the x-ray procedure, whatever, for a doctor to review it and then come and talk to you about it. And I don't know if there was only one doctor on or whatever.
What was happening.
It's
quite
not ideal.
Busy ward. It's full. It's got 2 waiting rooms. They're not huge, but it's a busy space. And as Jess says, it is the A&E for oncology. So when you start chemo, you get given a special number, and it says instead of ringing 999 if you've got any symptoms, ring this number. And then they pretty much always say just come in.
Yeah,
because they just want to take care of you. So that's a great system. We love the system.
Yeah.
So we get in for about 10, 10:30. Jess is seen within half an hour. She's had her obs, her bloods, and we go down to the x-ray. And then you're waiting a little bit there, but just as expected. And then you have your x-ray, and we all go back upstairs. So it's all fine. I guess, I don't even know the time. Maybe it was midday. I don't know what time it was.
Yeah.
And then we just sat there for ages, right, what's going to happen now? And to the point where we're nothing's going to happen now. So I leave to get Jess and me food, lunch, because there's an M&S, but it's a 5-minute walk away. And during that time, the doctor came and I missed it, so I was fuming. That was bad timing. Missed that.
Because I was like, yeah, go, no worries, it always takes forever. I won't be seen anytime soon. And then as soon as she left, the doctor came and got me.
So we're amazing, sad for me that I want to be there and understand what's being said, but quick. So yeah. Great. And then we got there. So I got back. Jess had this meeting with the doctor, and he was like, look, your bloods haven't come back. Now, I'd already been down to the pharmacy because I was collecting my meds that day, and they had already told me that there was an extra delay on all bloods for the week, and instead of it being 2 to 3 hours, it was 4 to 5 hours wait. So we weren't too surprised by that. Then we sat waiting then they said to Jess, we've done the x-ray. It could be a pulmonary embolism, and it could be a blood clot, or it could be an infection, and we're just not really sure what it is. And you might need a CT scan. You would only need a CT scan if we're unsure. At the minute, we are unsure, so you probably might need a CT scan. But you know what? I can't decide that, so I have to wait for the more senior doctor to come in.
Yeah, and he said, you're young, so we don't want to expose you to too much radiation. I was like, mate, we've really gone past that point.
We've gone way past
like,
that.
That's what's so many CT
it's
scans.
infuriating. But even like, you can't say you're worried about the radiation from the CT scan and also say, look, like quality of life, support the time you've got left. You're not suggesting that the radiation from the CT scan is going to impact me in 30 years, because you're giving us the impression that we're not even going to be around.
Yeah.
So who cares about the CT radiation?
Like, very odd reason to not give me
odd.
But he was like, I'll wait for my senior.
And what he didn't say is that the senior colleague wasn't coming in till 4 or 5. He didn't mention that. Bear in mind, it's like around midday. So I'm like to Jess, we're going to go to the Maggie Centre because I needed to go speak to the finance man. And so we go for Maggie Centre's great. We love the Maggie Centre, big tick. You can have a cup of tea, cup of coffee. When you're in all day, it just takes you out of hospital, which is nice. So we're about to leave, and we just say to the doctor, we're going to leave because, like, are you even seeing us? And then a nurse said, look, the senior consultant won't be back till 4 or 5, so yeah, just leave. So we're like, okay, we'll go. And the doctor then came and was like, oh, half of your bloods have come back, by the way. It doesn't look like it's going to be an infection. In that case, he thought a CT was even more necessary because he didn't think it was an infection, but still did not want you to have that CT scan that day, even though she could have already had it and just be awaiting the results. But no, let's just wait for the bloods to then wait for what to do to then wait for more results. But it's okay. So then we go into Maggie Centre, blah, 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 have a nice time, come back for 4. Well, I left at 4:30 when another of Jess's pals came in, and he hadn't been seen by then, for sure. So then you're in the waiting room for ages. All I know from this point in is that you don't leave till like 10:30.
Yeah.
And you need to explain the whole pharmacy bit as well.
Yeah, so then there was, the debate of, is it a blood clot, is it an infection?
Pulmonary embolism is a blood clot in your lungs.
Yeah. So then I didn't even see the senior doctor. It was just the same bloke that came back and was like, oh, the other half of your bloods are back and the infection marker is really high. So that indicates that it might be an infection. So I was like, right, okay. But they were like, we can't rule out that it's a pulmonary embolism still. So we will send you for a CT scan. And at this point, it was edging like later and later, like 6, 7 p.m. And I was thinking, I was just so done with it by the end of the day. I was like, I do not want to be in here. If they then send me for a CT scan and then I have to wait for the results, I'll be in like overnight. Like,
you would have ended up being in overnight.
So thankfully, they said, you can come in tomorrow for the CT.
But this is where I'm really pissed off, because they had the results, so they thought the CT was more important based on the risk of the blood clot. The CT doesn't help with the infection. So when the results from the blood suggested infection rather than blood clot, you'd think, so you might not need to do the CT. We're still doing the CT. So why did we not do the CT earlier in the day? We've been here all day.
Yeah.
And you're going to do it anyway. So let's just do it earlier in the day. And the reason why it really pisses me off is with this quality of life and enjoy the time you've got left kind of crap. Sorry, we've just spent a whole day. Now, Jess is really, you can see if you're watching this on YouTube rather than listening on Spotify, Jess is very calm.
I do tend to be calmer about these things.
I'm in my yang and I'm furious that a day spent. And not only that, she had to go in the following day, so that's a day and a half, and she's about to explain why they messed up all the other stuff in the pharmacy. She had to go in today as well. That's 3 days in a row. And that, I stay quite chill for most of the time if it meets my expectations. Like, I kind of know that it's going to be a long day when you go into there, but that was longer than I'd ever been in anyway. But then they were like, right, okay, we'll send you home tonight, come back in tomorrow for the CT, but just in case it is a blood clot, we'll give you an injection of blood thinners and we'll start you on some antibiotics. So we're getting like both covered, you'll be all right. So I was like, fine. And then this was, I would say, 8:10, he wrote me a prescription.
for the antibiotics. It was like, pick them up at the pharmacy, blah, blah, blah. Fine. So me and my friend still there waiting for the nurse to come, take my cannula out and give me this injection, and then we'll go to the pharmacy and we'll go home. So I then say, actually, to cut time, my friend Kels, why don't you go to the pharmacy, pick up the prescription, I'll get the injection, and then it'll get us out here before 10 p.m. But then I went and asked the nurse, and she was like, oh yeah, the doctor should have told you the pharmacy shuts at 9. And at this point, it was like just after 9. So I was like, okay, so we can't even pick up a prescription. And then she was like, okay, so because it's done digitally, I can never say that word very well, digitally. You won't be able to pick it up. So I'll have to get the doctor to write you a physical paper prescription now so that you can take it to this other pharmacy. And then obviously getting a doctor to do anything takes forever. So I was like, right, okay, well, we're not going to save any time. I'll just wait for that process to happen.
Yeah.
So finally get the cannula out, get the injection. Then we go down to the pharmacy. And I have also, alongside the antibiotics, I'd asked for these shakes called Fortisip, which are like, if you're struggling to put weight on, they're like super high calorie, really small volume of liquid to just like give you loads of fat, calories, blah, blah, blah.
Bulk
so
jets up.
Yeah, I'll try some of those, even though they are horrible. So ask for that to be put on the prescription. Take the prescription down. Pharmacy says, sorry, this is a ward prescription. We can't give this to you.
I'm fuming.
So I was like, right, okay, I'm in tomorrow anyway, so I'll sort that whole mess when I get back in. So yeah, that was, we didn't leave until like 10:30.
Yeah,
11,
that's what you said me, 10:30, 11.
After we'd picked up the antibiotics.
Bear in mind, I think I got you around 10. I reckon you were in for full 12 hours. Full 12 hours, I'm just going to tell you what happened. Bloods. And an x-ray.
Yeah, that's true. And a messed up prescription.
So in 12 hours, bloods which were done within the first hour, x-ray probably done within the first 2 hours.
And then so much sitting around.
And then just nothing. And I don't think I mind it necessarily, but I do mind the flip-flopping between, quality of life's so important, blah, blah, blah. But on the other hand, we might just take 3 days of your time.
Yeah.
And it's not like when you were in before and Jess was in for like 4 nights or 3 nights or something. I get that, that's for her safety because that was your infection.
Yeah.
That all makes sense. But this one wasn't that. This one was just while we wait to talk to people. If they just said from the get-go, look, I won't be able to tell you more until the senior doctor's in, and that's not going to be until about 5, then we would have spent 5 hours. We could have done anything. We could have spent more time at Maggie's. Yeah. We could have just been outside, left and come back. We could have gone to yours to relax. We could have gone to town for a coffee. There's so much you can do that makes you feel like you're using your day well.
Yeah.
And the waiting room was full. So, and there were 2 of us, and when Kelsey came, there were 3 of us for a minute, and then 2 of you again. So there's always, and a lot of people have someone with them. So the waiting room does get full. Like, we want to do you a favour and get out of your hair.
Yeah.
We will come back. Like, why we're just all here waiting.
Yeah, it annoys me when you're waiting because the system doesn't make sense. Like, having to wait for the doctor because you may or may not need a CT when we all know that he's going to give me a CT anyway.
Yeah.
And then waiting because they've fucked up the prescription, so now I have to wait for it to be rewritten.
It literally...
That annoys me.
Sends rage through
because
my
I'm
face.
like, if this worked efficiently, we could save time for everyone.
Yeah.
And
for everyone.
This whole system wouldn't be as...
Including for the NHS.
Pressure.
We want to help you, NHS. It's not even just for us. We want everyone to have a better time.
Yeah.
And it's not that we think that the blood should come back or results should come back or you should be able to communicate with the doctors within 2 seconds. It's that let's acknowledge that we won't and just send us away for a certain amount of time. Acknowledge that you won't know because the doctor isn't coming in until 4 or 5 in the afternoon. Just tell us.
Yeah.
We have other things we can do and we could enjoy our time. And then...
The little time we have left.
The little time. Enjoy the very little sparse amount of time we've got left. So it's just a joke.
Yeah, so that was the frustration. But
Jess is very calm and keeping her cortisol
Calm
levels
again.
lower.
The next day, it was so much more efficient, I must say.
Okay, that's good.
Which was good. So I went in. They called me in the morning with a time for the CT. Just said, come in when you can.
That's good.
No worries. So I went in, had the CT, got the results back fairly quickly. And then it's not a pulmonary
embolism.
It's an infection.
I don't know if we're yaying
I know.
this or
So
not,
this
actually.
is another thing that we were saying, like when we've said before, the stupid things that you become grateful for when you've got cancer. I was like, actually, the infection was the least worst case scenario out of that. So I'm actually really grateful to have an infection because it doesn't mean that I've got a blood clot and it doesn't mean that my cancer's got worse. Yeah. So it's like,
yay for
infection.
So yeah, we are kind of pleased. And you're on the antibiotics.
Yeah,
and
I'm
you're
still
just
quite
breathless. But you only just started the antibiotics on
yesterday.
No, the day before.
No, yesterday. Yeah.
Did you start them the CT scan morning?
No.
Did you start them the night that I was with you?
No, not the night. I started them. Yeah, the CT scan morning.
Okay, yeah. So you only started them yesterday, and is it 3 loads a day?
Yeah, 3 tablets a day for 5 days.
Okay, yeah. So yeah, we've got to give it a couple more days before it does anything.
Yeah, but also that has just triggered something else to add to the rant. Slightly annoyingly, the last infection I had showed up as a chest infection, but my doctor had said that it was a gut bug that had somehow migrated into my blood and was going around and causing infection elsewhere in my body.
Like from the bowel, from the poo, it spread a bit.
Or like a microbiome, like a gut microbiome.
Oh.
One of the bad bacteria.
Oh.
Because the bowel cancer has made my gut more porous. It had spread into my bloodstream, which had caused an infection. So that was like a really niche thing that they didn't expect. So I'd been on these broad spectrum antibiotics, which is what they've given me this time, and it hadn't cleared the infection because it was really unusual. So they only found out that it was that when they took a blood culture and tested it in the lab. So I was saying to this doctor, this has happened before. It was a really unusual bug. Can we just take a blood culture, check it in the lab to make sure that
get ahead of it,
not this? Because as he knew, I was like, I've got a meeting next week about clinical trials. If something comes up or starting chemo, I need to be in a physically well enough position to be able to accept treatment. And they won't give it to me if I've got an infection. So I was like, why don't we just test what bug this might be?
I feel a rage coming on, and
and he was like, no, that would be really unusual for that to happen. Your temperature, we only take blood cultures if your temperature goes above 38, and it hasn't done. So we're not going to do it. And I was like, but this is such an arbitrary little rule.
It is, just get ahead of it.
And I've been taking paracetamol, which brings your temperature down.
So you've really done yourself a disservice by doing yourself a service.
And they say that if you've, sign of infection is your temperature rising or whatever, but they're telling me I've got an infection, but my temperature hasn't been up. So how does that even make sense?
That's so true. We already know you've got an infection, and you did have a really quick heart rate.
Yeah.
And you've got breathlessness. You know, she's not fine.
Yeah.
There's other symptoms.
I was like, can we just
get ahead of it?
Just like, no. So I asked him 2 or 3 times.
I think you should ring your nurse.
Well,
I think you need to go over his head.
Useless.
I'll ring the nurse.
I'm meeting my doctor next week. So.
Yeah, but that's next week. What day is it next week? Oh my God, it's already Friday.
Yeah, exactly.
Oh, okay, yes, it's not really going to happen.
Anything done over the weekend.
Okay, fine.
But yeah, so that was another frustrating thing. I was like, this makes no sense. I know it's unusual, but it has happened before to me, and my doctor has told me that it might happen again. And so you're giving me broad spectrum antibiotics again, which might just be a waste of time for 5 days.
And that's just a waste of antibiotics as well.
Yeah.
And they say about antibiotic resistant stuff. Let's just be more specific if we can. And not for everyone, but Jess already has had the specific one. Because I knew that
this situation could happen again. I was like, logically, just makes sense for you to actually test what the bug is before you give me antibiotics.
It really does.
No. So here we are. I bet next week on the pod it'll be like, so is this oh, the random infection. I've still got an infection, blah, blah, blah. Let's hope not, but I just see the worst happening.
Jess's whole body is just falling apart.
It is.
Her hips hurt as well.
Yeah, I don't know why my hips sore.
But you've got that new pillow for your shoulders.
I have. I bought this little wedge off of Amazon, so it like props me up, and it is a real game changer.
We're gonna have to do a reel to like show the people what they want.
Yeah.
I had a wedge pillow for after surgery, and I'm wondering if it's the same thing, and you could have just had mine.
Oh, oopsies. Right, so that was a big rant.
Should we even talk about menopause?
I think that we should.
Okie dokie.
So the main topic, we'll do a quick 15 mins.
Quick 15 mins of men's.
On men's.
Not men's.
The men's.
The men's. So the men's. I was in October put full throttle into the men's. So I had an injection called Prostap. We've spoken about it, and I was gonna have it for chemopreservation of eggs anyway. But now I'm having the same injection, but instead of chemopreservation of eggs, I'm just having it to kill all my estrogen. And that one turns it off from your ovaries and your womanly area. And so that's the one that goes, whoa, menopause, you're in it now. And then I have a drug that stops your fat from producing estrogen, which just helps me kill the estrogen. So menopause, continue.
Yeah. So I think because I actually don't know much about the menopause and what it even is, but I had a quick Google today.
She's so prepared for the pod.
I think it's when your body naturally stops producing estrogen and progesterone.
That sounds about right, because my drugs stop those.
Yeah, and so usually you would get HRT, hormone replacement therapy, to kind of mitigate side effects and allow you to
Look at you with all the
live
knowledge.
more normally, and so you don't have
Balanced.
all of these crazy side effects. But obviously you can't have that.
I can't have
because
HRT.
you don't want any estrogen. So you have just been plunged headfirst into the menopause without anything that you can do about it.
Yeah, and as I was talking to Miranda, who's my doctor pal, and she was saying that normally when you go into menopause, you don't just not have a period ever again. I think normally you skip a couple of periods.
That's a process.
It's a process. Normally going into the menopause, I think, is a process, and you're actually, I have to tick all these boxes, and I've now forgotten the word menopause, but you aren't considered in the menopause until you've not had a period for 12 months.
Yes, I did see that on my Google.
Did you?
Yeah.
So actually, I'm not even in the menopause because I cut mine off in October and it's not yet October. But because I'm not in perimenopause, because it's not a process for me, I am induced menopause. I therefore am in the menopause. But most people go into perimenopause, which is you have a period, you don't for a month, you have another one, you might have another one, but then you don't for a few months. And it's that kind of teetering out of periods. And that's perimenopause. And then I'm pretty sure that's what that is. And then once you've not had one for 12 months, that's it.
Menopause.
You're in the men's.
Okay.
So I went cold turkey or whatever, cold plunge into it. So we're going to talk about the symptoms that come with the menopause.
Oh, yeah.
And Jess very smartly
brought a little Google again. So I didn't realise that there was loads, and a lot of these are quite difficult to know whether it's something else or menopause.
Yeah.
But so should I just run through
You
loads,
just do what you want.
and then you can
Should
talk
I just
about which
yay
ones
or
you
nay?
actually had.
Okay, yeah.
Hair loss.
Yes, had a bit of hair loss, had a lot of hair thinning, but my ribociclib is also doing hair thinning, so I couldn't tell you if it was the men's or the rides.
Irritability and mood swings.
Not at all.
Oh, maybe we should ask Mark this one.
Isn't that crazy? I just didn't have that one.
Okay, well that's good.
I think I was a bit more emotional, but we also have to remember I went into the men's less than a month after finding out it was stage 4.
Yeah.
So I don't know. I wouldn't be able to place my emotion for if it was men's or something else.
There's hot flushes and night sweats.
They were awful.
Yeah. this
All
has been
my
one
hot
for you, hasn't
flushes
it?
were happening at night, so night sweats, and to the point where I couldn't sleep, and I would be like up like every 20 minutes I'd wake up sweating, take all the covers off, but then obviously my body was wet and I'd wake up cold.
Oh, yeah.
And then I'd put my covers on and then I'd wake up sweating, and it was like just a process, and I wasn't getting any sleep. And then that happened for like 5 days in a row, and I was at the end of my tether, and I rang the doctors and I was like, I need to sleep, and they're like, okay, we'll book you in for next week. And I told Mark, and I was like, I don't think I can do it. And Mark's mum spoke to someone else who then said, why don't you just ring them back and say you really can't sleep? So I rang them back and I said, I just burst into tears and I was like, I have to sleep tonight. If I don't sleep tonight, I don't know what I'm going to do. I have to sleep tonight. And it wasn't tears about the cancer. It really wasn't. It was tears. I was just so unbelievably tired.
Yeah.
And they prescribed me Zopiclone. That day they were really nice on the phone. They were like, we get it. Come in. Go collect your Zopiclone. Just have a sleep. So it was super great. And I had a Zopiclone that night and I felt which was amazing, had the best sleep. But the night after I got no sleep, because I think the Zopiclone is so strong, but I haven't had a problem with my sleep after that.
Oh, that's good.
And I only have a Zoppy. I have like half a Zoppy, and it's super rare. It's like, I don't think it's probably even monthly. It's like only if I'm really feeling behind on sleep.
That's good.
Yeah, because they're super addictive and very dangerous.
But that's a big side effect.
Big
for you.
Big
on the
big
menopause.
night sweats and hot flushes.
Brittle nails.
I don't know about brittle nails. I don't think so.
Okay.
But I'm having calcium every day as a supplement, so I don't know if I'm already countering that.
And another one, joint pain and osteoporosis. But again, you're kind of mitigating that.
I'm mitigating it. I'm at high risk of osteoporosis because the cancer's in my bones and because of the menopause. So I'm like double, and I think cancer in general. So I'm like double risk of having osteoporosis. So they've said you've got to do loads of strength exercises to keep your bones really strong. So I've been doing weights, which I talked about in a different one. But the reason I did weights is because of the osteoporosis risk I'm now at. So I go to a menopause old lady, middle-aged lady specialist, and she just does like bone strengthening stuff.
Oh, that's good. I didn't realise she was a specialist.
Well, you know how it's like, I reckon most of her clients are that age, so she's just become that way.
Oh, okay.
Yeah. She'll see anyone.
Brain fog, difficulty concentrating, dizziness, headaches and migraines.
Brain fog I really had, especially at the start, and I really worried it was brain cancer. So I never got a scan of my brain, and I once rang the nurses shortly after I found out it was in my bones, and I was like, I can't remember anything. Obviously there's a lot of stress, so that was probably why, but I was like, I can't remember anything. I'm like, how do I know it's not in my brain? And they said, well, you've not complained of confusion or headaches. And I said, no, but I didn't complain of bone ache, but it was in my bones.
Yeah.
And they were like, what? You didn't even like have a symptom of your bones? I said, no, I didn't have one symptom of my bones. But it was there anyway. And they said, well, do you want a brain scan then? And then I said, absolutely fucking not. Do you know what? Let's let this lie.
On reflection.
On reflection. Not a good idea. I've got enough cancer.
Yeah.
As it is. So I never got the brain scan and it's never been tested. But like that's when you have to start, you'll know, you have to start engaging logical brain.
Yeah.
And being like, look, it's really unlikely that it's also in my brain. And it's the menopause and it's the stress.
Yeah.
And I don't have confusion really. And I don't have headaches. And it'll be the menopause brain fog.
Yeah.
But Mark says, because I've quit drinking, he says I've become, over time, a lot sharper than I ever was.
Oh.
And he says he thinks it's the zero drinking. So my brain fog has eased.
Okay.
But there was a time where I couldn't get any words out. You know, when you're like, you know that word, blue. But you're like, it's like purple, but not purple. And everyone's like, you're insane.
Okay, but yeah, that's why these are a bit tricky, because they can be from lots of other things.
Yeah.
Changes in body odour. which is an unusual one.
I
haven't noticed that you smell, to be honest.
Okay, thank God. I don't think so. Yeah, I don't think I've had that. No one said anything. Mark did say at one point he was worried my odour had changed.
Oh.
And he didn't like it. He was a bit sad by it. But then we decided it was that I'd had too much kimchi that day.
Yeah.
And it was like coming out my pores or something. You know, like when someone smells of alcohol from their pores?
Yeah.
He was like, it's the kimchi, it's coming from your pores.
Okay, and then when you stopped eating kimchi,
he doesn't smell it. Yeah, he only ever says it on the days that I eat kimchi.
Okay.
So I think it's that, but that's weird.
Irregular heartbeat?
No, on my ribociclib, they really worry about irregular heartbeat. And you have to have a heart test for the first 3 months. You're on it, but mine's fine. But that is a big thing.
Okay. And then breast pain, which I imagine can be a little bit scary if you already have breast cancer.
I mean, I've only got the one breast now, and it's fine. No breast pain for me.
Bloating? Yes
to bloating. And I was also told that with the lack of hormones, it all happens. You bloat in your belly, and that's why a lot of people that get to menopause put loads of weight on. But again, I've done so much exercise. I still bloat, but I always did bloat, and I do loads of exercise to try and counter any weight because I'm scared of estrogen and fat. Yeah,
to be fair, it does also say weight gain on here. Bloating, digestive problems and weight gain.
Yeah.
Tingling extremities.
No.
Unusual one.
No.
Gum problems and burning mouth.
I had a bit of cold sores, but I was told I would have cold sores as well. They're a side effect of ribo.
Okay.
So I don't know, but they're not being too... When I say cold sores, I don't mean the mouth ones, I mean the in-mouth ones. Like, you know, little sores.
Yeah.
They're not bad.
And then loss of libido and vaginal dryness.
Vaginal dryness is so real. So, yeah, but you can get prescribed, because I was like, let me look into this. Let me do a big research session. And you can get prescribed, so you don't have to pay, because when you've got cancer, we get free prescriptions with medical reasons.
Yeah.
So I could get a free prescription of lube, or you can also get pipettes. They're like suppositories, are they?
Oh.
That you put up your vagine and they keep it moist. So I haven't really used them. And it's not like, I'm sure you could use the lube for all the naughty things you get up to, but it's actually, I think, just for if it's really irritating and like really dry, itchy. But mine's not, like I got it because I was like super prepared, wanting to be proactive.
Yeah.
But I've actually not really used it. I used the suppository once. And after you put it up, it's meant to last for like 3 days. And for the rest of that first day, I felt like little bits were leaking out. But the other 2 days were fine. And it was nicer to have it in, having done it. But you'd have to wear like a little panty liner that day that you put it in. So then you want to just be aware of what you're doing.
Yeah.
But yeah, vaginal dryness
is a thing.
It's real.
Well, yeah, that is most of them, I think, all of them. But that's surprising. I didn't realise like you do hear about some of the standard ones, but things like gum problems and I don't know, insomnia, allergies. Like if you just got a new allergy,
yeah, isn't it crazy?
Weird.
Like some people just get hay fever.
Yeah,
I would be so pissed off if I just got hay fever. Like, are you joking?
Got enough to deal with.
Let me enjoy the outside.
Yeah,
be fuming.
Oh God.
But yeah, no, my menopause, the rest of the hot sweats and not sleeping were awful, but everything else was okay, and there are things you can do to manage it. So hot sweats, just if anyone's interested, not having a heavy meal just before bed makes a huge difference.
Oh, that's good.
Because if you have a heavy meal and your insulin or like glucose will spike, that really brings on a hot sweat. And for me, that's really real. That's a really true thing. So having a lighter meal before bed is huge. Eating at least a few hours before you go to sleep is huge. And having a cold fan. I'm borrowing my mum's Dyson cold fan, and it's the best thing that's ever happened to me. Probably couldn't have survived menopause without it.
And you said acupuncture helped to
Acupuncture
get all
helped.
the heat out.
She put one of the things, and I think I've said on a different pod, she put one in my wrist and left a red mark, and I swear the heat literally left my body.
Yeah, that's so good.
So there are things you can do to mitigate some of it.
Silk pillowcase?
Silk pillowcase, although that was mainly for hair loss, but actually that stays cool on the underside.
Yeah.
So that's why people like that.
Yeah.
So yeah, if you are going through the menopause and there's anything that I might be able to help with, let me know.
Yeah. There you go. That was so efficient. A quick 15 minutes on
The menopause. The men's. And then I was going to do a reel on my get ready with me, because that's what the cool kids do. And then I accidentally was trying to talk and I said meniskin instead of menopause. And then I thought I'd made up a new word, meniskin, about dry skin, because that's real, guys. Elasticity goes, collagen goes. It's all dry and gross. And I went on a huge spending spree on skincare to be like, I will not have shit skin. I'm 34 and want to look 29. And I thought I made up the word meniskin was the point of this, but it turns out my Instagram heard me and someone else came up with meniskin.
Oh, that's a real shame.
Yeah, I know.
That's a real good, brand name.
Yeah, isn't it? So I don't think I came up with it.
Oh.
I know.
But yeah, so you can look out on the Instagram. We'll do something on menopause skin.
Yeah.
And the products that you use to help with that. Meniskin.
Very good. And we're going to do a reel on how gross your food is that you have to eat.
Yeah.
Yeah, that's coming soon.
Cool.
It might come
Otherwise,
before this. It might already be there.
We don't know.
We don't know. Right, guys. You have to say the goodbye. I've talked so much.
Thank you again for tuning in. And we hope you enjoy the updates. And we will see you next week.
See you next week.
Like and subscribe.
Like and subscribe.